This is a PowerPoint lecture for gastrointestinal medications. It's part one. We're going to overview the GI system, laxatives, antidiarrheals, and some GI disorders and the associated medications. The gastrointestinal system consists of a long tube called the alimentary canal that begins at the mouth and ends at the anus. This canal is responsible for four major functions of the digestive system: ingestion, digestion, absorption, and excretion. The stomach environment is high in hydrochloric acid, which helps to break down food for absorption. GI medications work to increase or decrease function by changing the muscle tone. They can replace deficient enzymes or increase or decrease the emptying time or rate of passage through the system. GI medications are used to treat GI disorders or to control GI symptoms. Timing of GI medication administration is really important. Some medications are taken to coat the stomach lining or reduce gastric acid and should be taken on an empty stomach. Other medications should be taken with food to enhance absorption. Some foods, such as grapefruit, can affect the absorption of certain medications, so it's important to understand the effect of food and medications on the GI system. Many of the medications we've talked about have a systemic effect on our body systems other than the one the medication is prescribed for. For example, when we affect smooth muscle to open up the respiratory tract for the asthmatic patient, peristalsis slows down, causing constipation. Remember that sympathetic nervous system? That's it. Constipation is defined as infrequent hard stools, and laxatives help to kind of move that along. As you can see, there's 6 different kinds. The bulk-forming laxatives increase bulk in water, and they take 12 hours to 3 days to work. Psyllium is an example of that, or Metamucil. Lubricant laxatives increase water to fecal mass to ease passage of stools, and those usually come in suppositories. Osmotic laxatives draw water into the stool and irritate the bowel to increase peristalsis. An example of this is milk of magnesia. It usually works in about 2 to 12 hours. We also have stimulant laxatives that stimulate peristalsis by irritating the bowel. Bisacodyl is an example of that. And also we should consider castor oil. That should not be given in pregnancy or during lactation because it can cause premature labor, and it also can cause diarrhea in the nursing infant. Stool softeners decrease consistency of stool. They attract water and fat to the stool to soften it. Docusate sodium is a very common example of that we use in the hospitals. And lastly are bowel evacuators. They're cleansing solutions. They may be used before diagnostic tests to remove stool and cleanse the bowel. These, of course, can cause nausea and fullness. One example is polyethylene glycol, and the brand name of that is kind of funny. It's called Go Lightly. Antidiarrheal medications are used to stop or slow down loose stools. Diarrhea is a symptom, not a disease. Diarrhea can be caused from inflammation, infection, or medications like antibiotics. Diarrhea can also signal that someone has eaten contaminated food. It's important to note if diarrhea is caused by this kind of bacterial infections, such as salmonella, antidiarrheal medications are not recommended because the body is trying to expel the bacteria through diarrhea. Diarrhea can not only be painful and cause cramping, but it can also cause life-threatening loss of fluid and electrolytes, especially in our geriatric and pediatric patients. Loperamine or Imodium is an over-the-counter medication for diarrhea. Diphenoxylate or Lomotil is by prescription, and it's important to note that this is a controlled substance class 5. This medication is chemically related to the narcotic analgesic meperidine or Demerol. Absorbents like bismuth or Pepto-Bismol coat the walls of the GI tract. Medications classifications that may be used to treat the cause of diarrhea may include antibiotics, anti-inflammatories, or antiparasitics. Oral candidus, or thrush, is a fungal infection of the mucous membranes of the mouth. While with thrush, there are white patches on the tongue or cheek, and it may actually extend into the esophagus. The times that I have seen thrush are usually with patients who are on antibiotic therapy. Remember again that antibiotics can destroy that good bacteria in the mouth, which may make patients susceptible to fungal infections. Nystatin, the troches or suspension, may be ordered for this. Intestinal candidus can also occur, and nystatin tablets may be ordered, which are swallowed whole. Remember with the troches, do not chew or swallow. Allow them to dissolve in the mouth. With nystatin suspension, it's usually held in the mouth, swished as long as possible, and then swallowed. When the term morbid obesity is used, what it means is that a patient is 20% above their ideal body weight. Obesity is really tough on our bodies. It increases the workload for the pancreas, the liver, the circulatory system. Everything really struggles when we're too heavy. Appetite suppressants are commonly used to treat this. They give the patient a feeling of fullness, so that helps them decrease food intake. The problem is that most of these medications, they're controlled substances, they're amphetamines. Other medications that can be used for this are lipase inhibitors, and what they do is they bind to the enzyme lipase, and the intestines can't break down the dietary fat, so the fat's eliminated from the feces. These meds cannot be given to children, and they're not good for patients with. Here are some miscellaneous GI medications and disorders. Cholelithiasis, or stones in the gallbladder, may be caused by cholesterol or calcium. Most patients with severe symptoms have their gallbladder removed. But if they're unable to tolerate surgery, your sodiol can be given. This medication dissolves gallstones, but they can take up to 2 years to work. Here's some trivia for you. Your sodiol is one of the bile acids, and it's produced by the Chinese black bear and has been used in the treatment of liver disease for centuries. Nowadays, however, it is produced in the laboratory. Flatulence is gas released by the GI tract. Antiflatulents like dimethicone, or Gas-X may be used. Anthelmintics are medications that are used for intestinal parasites like roundworm, tapeworm, and pinworms. These medications are neurotoxic to the parasite. Some medications are used to induce vomiting to rid the body of harmful substances. These are called emetics. Syrup of ipecac induces vomiting in about 80 to 90% of patients within about 20 to 30 minutes. This medication has been widely used even outside of the hospital setting, but parents are now advised to destroy any syrup of ipecac in the home because they may cause more harm than good. For instance, if you have a corrosive substance that's ingested, more harm will be done if you induce vomiting. Most poisons are treated with activated charcoal. Activated charcoal attracts the toxin and inactivates the poison. The poison is then excreted in the stool. If you have a problem or suspected poisoning, individuals are really encouraged these days to call the Poison Control Center, and this is the 888 number, which is good nationwide. Well, this concludes part 2 of gastrointestinal medications. If you have any questions, bring them to the cafe or bring them to class.